The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining us today on our webinar. And this is one of the webinars offered through the Michael and Susan Dell Center for Healthy Living. I'm Shreela Sharma. I'm a professor of epidemiology at UTHealth School of Public Health and co-founder of Brighter Bites nonprofit organization. And I'm also a faculty member in the Michael and Susan Dell Center for Healthy Living. And I'm presenting today with Mike Pomeroy, who's the Senior Program Director at Brighter Bites. And today we are going to talk about a rapid response to food insecurity and other social determinants of health during COVID-19. So I'm going to hand it over to Mike to get us kicked off.
Thank you, Shreela. First, we wanted to set the table a bit. If we could go to the next slide and explain to everyone just who Brighter Bites is during normal times, if those still exist. So Brighter Bites' mission ultimately is to create communities of health through fresh food. And we do this primarily in schools, elementary schools, and we do it in 6 cities across the country: Houston, Austin, Dallas, Southwest Florida, Washington, D.C. region, and New York City. Next slide. So what families in participating Brighter Bites schools receive across the full school year is 16 weeks of this 3 simple program elements. Produce distribution, about 20 to 25 pounds of produce per week per family, along with nutrition education, both in the school for children and at home for parents, as well as a fun food experience, a way to help parents and kids learn about eating healthy and making it fun. So we do this weekly for 16 weeks during the academic school year, only in schools where there's greater than 75% of the children are enrolled in free or reduced lunch or are designated as Title I. And then we also have up to 8 weeks in the summer with other types of organizations, YMCAs, Boys and Girls Clubs, summer schools, to continue providing food access during the summer. And we, along with all of this, we continually measure our outcomes to really determine that we're having the impact we intend to have, which is to help change families' behavior and increase their fruit and vegetable consumption. Next slide. So we started in 2012 as a small pilot project, and since then we have provided over 27 million pounds of produce and millions of nutrition education pieces to over 275,000 individuals, representing 53,000 cumulative families, at over 250 schools and camps across Houston, Dallas, Austin, New York City, the Washington, D.C. metro area, and Southwest Florida. Next slide. So as I mentioned, we have since the beginning had a grounding in measuring our outcomes, and that came from we were founded in the University School of Public Health with Dr. Sharma at the helm, and so that was the initial community academic partnership that launched this program, and it's been a real backbone of our success since then. So I want to turn it back over to Shreela to talk a bit about that research and what we have done.
Thank you, Mike. So as Mike stated, we have a really strong community academic partnership with Brighter Bites at UTHealth. And as a result of which, we have tried to build several of the backbones needed to have strong implementation, evaluation, and dissemination and sustainability of the program. Because as Mike mentioned, the program is now disseminated across 6 cities in the country. We are theoretically grounded, so Brighter Bites is grounded in the social cognitive theory construct. We've done several research studies to determine program effectiveness on behavioral outcomes, and have several other studies in the pipeline to look at health outcomes. In addition to that, grounded in the REAIM framework, we document program dosage, reach, fidelity, and acceptability of the program in real time across all the sites. And we'll talk about that. But in addition to the research, as part of ongoing program evaluation, families that enroll in Brighter Bites also complete surveys and are part of our longitudinal database to track behavioral outcomes, which include child and parent fruit and vegetable intake, home nutrition environment, school nutrition environment, and so on. And then we also collect a lot of qualitative data to help us contextualize the quantitative data as well. Next slide, please. So this is just going into some of the research and the data that we've garnered from this research study. So we did a study back in 2013, 2015, where we had 6 interventions, 6 comparison schools, and we found, next, if you can go through the next few bullet points, please. We found that families that participated in Brighter Bites reported there was a 2-fold increase in cooking meals from scratch, significant increase in eating meals together, serving more produce as part of the meals, which was all part of our logic model on improving the home nutrition environment. We also saw increase in using nutrition labels to guide grocery purchasing decisions, a significant decrease in added sugars consumed among children. Next slide, please. Oh, yeah, thank you. And then we also found that not only did we see improvement in fruit and vegetable consumption among both children and parents during the 2-year study, but we also subsequently did a 2-year follow-up on the cohort and found a maintenance of effects among families. And in fact, the slope was steeper at the 2-year follow-up for child and parent fruit and vegetable intake as compared to baseline. Next bullet. And then we've done some other research studies. You know, we heard anecdotally from the schools that children were eating more fruits and vegetables at the school lunches. You know, they're going home with a good 20 to 25 pounds of produce, which is, as you can imagine, it's a substantial amount, and they get a variety of produce. They get 8 to 10 different kinds of fruits and vegetables each week. And the idea, you know, the Brighter Bites bag is built in a very specific way, such that the intent is to create an excitement among the kids for fruits and vegetables that may not exist in the families. And so the bag usually has a variety of produce, including, you know, 4 to 5 different kinds of fruits and 4 to 5 different kinds of vegetables that they can enjoy and share with their family. And the intent is to then create a demand for these fruits and vegetables. And so when we heard that at schools as well at the school lunches that these kids might be eating more, we said, okay, let's investigate in that, you know, for that. And we sampled schools in Houston and Dallas and found that children in the schools that participated in Brighter Bites did have a greater consumption of fruits and vegetables at their school lunches as compared to children that were in schools that did not participate in Brighter Bites. And so that was another research project that we did as well. So this was a measured plate waste study. Next slide. You know, the qualitative data is as important as the quantitative information, and especially when you're trying to implement a multi-component program like Brighter Bites. As Mike mentioned earlier, there's 3 large pillars. There's the produce distribution each week for 16 weeks in the school year, and then there is the nutrition education, where an evidence-based catch program is implemented in the schools. There's also produce activities, so everybody in the school can participate in the program, which means that the teachers and the principal and the kids and families, everybody can participate. So each week, they should actually get their produce bag delivered to their classroom, and they can take the produce out and share, show the produce and do a short produce activity with the kids to, again, generate the excitement. And then, you know, the bags go home, and we have a lot of bilingual nutrition education information that we send home to the parents. That's less about, it's less about, you know, oh, vitamin K in spinach is great for you. And it's more about how can you make that spinach last longer and, most importantly, taste delicious. I mean, we all know that flavor and taste are major mediators of behavior change, especially for kids and adults. You're not going to eat something if it doesn't taste good. So given that there's are all of these components happening in tandem, the qualitative data becomes important to help contextualize the quantitative findings. And so we've done, as we did these quantitative studies, we did a lot of qualitative work as well. And there were many themes that came out, but this is the one that, a quote that sort of personifies the thought process behind Brighter Bites. And a parent said, "Brighter Bites made me cook things I wouldn't have bought for fear of wasting money if my children didn't like it." And that is precisely what we are trying to do with Brighter Bites, which is demystify the produce in families, because as we know, due to generational lack of produce and lack of access to fresh produce, you're going to lose the skills to cook the produce the right way and in a way that's tasty. You're going to lose the taste for it, and so on. I'll share a story that goes along similar to this quote, where first year when we were bagging the produce each week at the schools, the parents come and volunteer at every distribution, and this mother would come each week, and she would say that, you know, you guys have been giving us Brussels sprouts, and I don't buy Brussels sprouts because I don't like it. I grew up eating boiled Brussels sprouts, but because of Brighter Bites, I learned how to roast the Brussels sprouts, and now my kids love it. And so even when I don't get Brussels sprouts through the Brighter Bites bag, I go to the store and buy it. And that's kind of, you know, the philosophy of demystifying produce among the families that are participating. Next slide, please. So the intent of this particular presentation is to focus on what is happening in regards to COVID-19 in our families. As Mike mentioned, a majority of the criteria for schools to participate in our program is that over 75% of the children are enrolled in the free and reduced lunch program. So they're predominantly lower income families. And our baseline data shows that over 70% of them are food insecure, and that's kind of stayed consistent year after year. And we knew, so next slide, please. So we knew that when COVID-19 hit, Brighter Bites had to stop its traditional programming abruptly because of school closures. That was, you know, the Brighter Bites programming team is incredibly passionate and vested into the communities that we serve. And we didn't want COVID to end our communication with the schools and the families. And so rapidly, Brighter Bites decided to try to reach the families, to identify the needs, and then pivot. How can we pivot to provide resources? But we have to know, before you pivot and try to provide resources, you have to know where the families are at during this time, and which is why we did the rapid response survey with Brighter Bites. Next slide. So just to level set, you know, this is just some data in regards to food insecurity in the US. So this is done by the USDA Economic Research Service. Among food insecure households, there's about 14% food insecure households in 2018. We also know that rates of food insecurity are higher among households with children. Next slide, please. Now, I want to direct your attention to the two bar graphs on the left, so we'll go from left to right. As I mentioned earlier, part of Brighter Bites program evaluation effort is to longitudinally track the families. So families typically, when they enroll into the program, they enter into a tracking database and they get a barcode, which they can get scanned each week when they come to pick up their bags of produce, and they also get a link to complete a baseline survey. And the survey asks them various questions, including questions about food insecurity. We use an NIH screener for fruit and vegetable intake, as well as intake of other foods, eating out from restaurants, we use the CDC Murphy questions to ask about their shopping behaviors, where do they shop at, and how frequently do they shop there, as well as various socio-demographic questions. So we administered some of those questions as part of the rapid response survey. And then we also asked them about, some of their other concerns regarding contracting COVID, and do they have other social needs, which we'll get to in a minute. But we found that at baseline, this was in fall of 2019, 71.5% of the Brighter Bites families were food insecure, and this increased to 93.5%. So there was a 22% increase in food insecurity among the Brighter Bites families. This COVID rapid response survey was conducted in April 2020, and what's important to note is that in April 2020, pretty much all of the cities that Brighter Bites was implemented in were in shelter in place. So they were in this lockdown mode. And so they were experiencing a universal environment in regards to COVID-19. They're eating food from any restaurants decreased significantly as well. So from 12.7% who said they never eat food from any restaurant in the last, including, and this went down to 62% saying they are not eating food from any restaurant. But interestingly, shopping, so majority of our families, regardless of where they live, they're shopping at the large grocery store. So over 85% of our families shop at the large grocery stores, and we found that this decreased slightly, but not by much. So their frequency of shopping at large grocery stores kind of stayed about the same. Next slide, please. I wonder. This slide is, for some reason, this slide is not showing the numbers. But this slide was essentially demonstrating the social needs of our Brighter Bites families. And in addition to food insecurity, a majority, so the 76, I apologize for the slide, 76.3% said that they were experiencing financial hardship. A significant proportion, about a third, said that they had challenges with access to healthcare, and access and affordability to food was challenging as well. So there were about approximately 60% said that they were experiencing challenges with both accessibility and affordability of the food. What was interesting is that very few, so the two tiny bars, but unfortunately about transportation, and very few of them experienced any challenges in regards to transportation at this time. It was primarily unemployment, financial hardship. The two large bars that you see are related to financial hardship, concerns about their employment status, affordability and accessibility to food, and access to healthcare. That were the main concerns about from these families. Next slide. We also, so something else that we did was that we asked the families at the end of the survey to share their greatest concern with us. And this was important because, again, we've learned through Brighter Bites that the qualitative information is as important as the quantitative one. And so on the very left are the 4 themes that bubbled to the top in regards to, from the comments that we received from the survey. So fear of contracting COVID, and this is just a smattering of the sub-themes that you see in the second column. But the fear of contracting COVID was quite high. So families were not just concerned about getting it for themselves or their own families, but concerned about spreading it to others, concerned they did not feel like they had enough PPE and equipment, didn't feel like they had the option of staying at home and supporting and reducing their risk of infection. So there was a lot. There were about 9 sub-themes that actually emerged from this particular theme. Disruption of employment status and financial hardship pretty much kind of went hand in glove. There was a great fear of being unemployed across the board, with the majority of the families worried that they themselves or their partner was going to lose their job, and grave concerns about being able to pay the bills or having enough money to pay their rent and other utilities. And then last but not least, concerns about food insecurity, not just, of course, for themselves, but for their kids, other family members, and not having enough healthy food to eat as well. Next slide. So when we saw these comments, we actually, so the reason we called it a rapid response survey is we wanted to respond. It's not that we wanted to do the survey rapidly as much as we wanted to respond rapidly to the needs of the families. And so when we read the comments, we decided, we actually realized that there were 2 groups among the families who responded to the survey. One was this overall, everybody who's kind of in need, but within that, there was a subgroup that was more of an SOS need, who they raised their hand and they were telling us in their comment, and I'll share the triage protocol in a minute, but they were essentially saying that we need help right now. And so we called them the high risk group. And so we then sat down and adapted, I'm an epidemiologist by training, and sort of adapted a rapid response protocol that we use in epidemiology to provide emergency assistance for these high-risk families. So we set up a triage criteria for the high-risk families. So that's, I'm just going from top to bottom of this protocol. Set up a triage criteria to identify the high-risk families. Then we set up a tracking database of these high-risk families. We immediately followed, so we had a timeline of a follow-up with these families to elaborate on the concerns, all the conversation. So this happened between Brighter Bites and the staff. It was centralized Brighter Bites staff that called all the families and spoke with them and elaborated on the concerns, which was then documented in this tracking database. And then based on that, a response response was generated, which I will talk about in a minute. A response was generated to meet the need immediately. And then the response was documented, follow-up was conducted with the families, and if there was additional need, then it went back to that articulating and deploying a response. Next slide, please. So this was the triage criteria. So on the survey, they responded as being a poor health status. So it was about 20% or so. No, it was a small. It was less than about 10% that responded as being of poor health status. And then on the open-ended question, which asked them, please share your greatest concern at this time or any other thoughts you would like to share with us, they responded with the following responses. So if they were running out of food, they were diagnosed with COVID-19 or living with someone and experiencing challenges, or if they were ill and needed assistance right away, or they're about to lose their place of living, about to lose their utilities, or no one at home is making an income. All of these, if they met any of these criteria, they were categorized as a high-risk family. And you will notice that many of these criteria have nothing to do with food. And that is an important consideration and a decision that was made by Brighter Bites leadership when these comments came in that at this time, we need to make an attempt to meet all of their immediate needs as much as we possibly can and connect them to agencies that can help support or provide them with information that can help support these other needs. So it was a very purposeful decision, and this was done very rapidly within a span of 48 to 72 hours on developing this and putting it into action. Next slide. So I'll hand this back to Mike to talk about the various strategies that Brighter Bites has implemented as a result of these data and various partnerships that have come into fruition to respond to the needs of these families. Mike?
Thank you, Shreela. As you mentioned, to wrap up what we did with the emergency assistance response, we worked with gift cards to local grocery stores. We made actual deliveries to families who weren't able to come out of their house of groceries. We bought infant formula for families who needed it, and either made digital deliveries of these things to help families with the resources they need, or in cases where they weren't able to access the resource digitally, we made in-person deliveries across Houston, Dallas, Austin, Florida, all of our cities. And so that was meaningful to us as staff at Brighter Bites, that our family trusted us enough to be honest with us and let us help them in these ways as well. Next slide. Another thing that we did was initiate a program of produce vouchers. Our goal of delivering weekly in-person amounts of produce to our family was disrupted by COVID-19's closure of the schools. We could no longer bring parent volunteers together to pack produce in these locations. And so we had to think about how to still help our families who were in more need than ever, and as Shreela showed, that had a higher risk of or probability of food insecurity. We knew that the grocery stores were open. We were learning every day on the news about how these are our new essential workers, and that these are the places that will remain open even amidst lockdowns to help feed the population. And Brighter Bites has been working for several years on deepening our ties to both the produce industry, but also the retail industry and their relation to the produce industry, leveraging their relationships to the produce industry. So we were able to start here in Houston and Austin with a partnership with H-E-B stores, which includes their other markets such as H-E-B, Jovi's, Mi Tienda, and Central Market. Those are primarily in the Austin and Houston areas. So we focus focused on our families there, and sent them a sequence of mailed-in vouchers, $25 that was only available to be used in the produce department of HEB. So we had to gather their snail mail addresses, and that was the whole effort of our team reaching out to our families, and then we began mailing those out. So since we started in Austin and Houston with HEB, we've been able to replicate this program in Southwest Florida with a partnership with Winn-Dixie, which is a grocery store in the South. In Dallas, we were able to leverage on a partnership with 99 cents only stores. They actually are one of the few dollar stores that consistently has produce departments in their stores, and we had been working with them previously to have them help donate produce to our program, and so we already had some relationships to get started on a voucher program to enable families in the Dallas region to just go spend it only on the produce department. And same thing with Walmart. We were able to work out a retail agreement with them where all of these retailers are helping pay for a portion of this voucher. We're getting a discount, and the Brighter Bites did a lot of special fundraising to help support this for all of these cities. Next slide. Here's a great picture of some of our families at one of the schools here in Houston who were so grateful to receive their vouchers. And we saw a really great redemption rate. 69% of the first voucher that was sent out, 69% of the families were able to redeem that. And that's in the retail world, from what we understand, that's an extremely high percentage. That normally you see things around the 30% redemption rate when you send out coupons of this nature. So that really also just indicates the need that is out there right now. Next slide, please. The next thing I wanted to bring up that we focused on since COVID, part of our pivot as an organization, is working with a large grant program that was part of the CARES Act, administered through the USDA, called the Farmers to Families program. It's a federal initiative that was developed to distribute free agricultural products such as fresh produce, which is our specialty, but also dairy and meat, to families all over the country that are in need. So there's lots of organizations across the country participating in this, and we were lucky enough to participate in all 6 of our cities. So since that program started, which was mid-May, we've been delivering 50,000 produce boxes per week in each of our cities. We have about 25,000 school year families, and our priority was trying to locate these box distributions in a school, in a YMCA near the school, somewhere to help our families who already knew us and trust us, help them be able to access these boxes. But the program has also enabled us to open up our program to the whole community. And so, excuse me, in all of our cities, these boxes are being delivered to new partner organizations, new orgs that we haven't worked with before, and we're opening up food distributions on a weekly basis to families who are in need, both Brighter Bites families and other families that live in our communities. Next slide. So here's some fun photos of all of our events. We've had some little helpers that help with our car distributions. Lots of volunteers from partner organizations as well as our own staff who's been out in the hot sun this summer helping deliver these produce boxes to families. To date, we've delivered over 225,000 boxes in our 6 cities, representing nearly 5 million pounds of produce. So we're really proud of our ability to take part in this and help this many families. I see a few questions coming in. I'm going to get through the strategies and then we'll back up and answer some of those questions. So could we go to the next slide? This is a picture that was taken in Brooklyn in our efforts there at some of our new schools in Brownsville and Bushwick regions of the city. This is the Brooklyn Borough president, Eric Adams, who came out to visit our distribution. And he spoke rather eloquently about how COVID-19 has shown that our community needs to stand together to help each other at this time. And we at Brighter Bites are really honored to be part of that and to have made so many new connections to be able to do that in each of these cities. Next slide. So another thing that we focused on that we learned from that COVID rapid response survey was that we needed to help our families with a wide variety of information beyond just why it's important to eat the rainbow, beyond just why you should have half your plate be fruits and vegetables. Those are normal topics that we teach to families and kids. But we realized that there was really a knowledge gap when it came to how COVID-19 is contracted, how they can receive testing if they need it, where they can acquire PPE, what other assistance programs are available for utility support or eviction support, as well as just continuing to maintain healthy nutrition in this difficult time with the many additional challenges that families are experiencing, the toll that mental health is taking on them, and having kids at home. There's just a lot of extra stress that mom and dad had to do. And so we worked with the UT School of Public Health and students from the Baylor College of Medicine to really beef up our health literacy offerings. So on the next slide, we can see a glimpse of what this looks like. Well, first, it was a total of 90 resources that were created in the form of web links, infographics, and flyers, distributed to 24,000 plus families starting in late March. And we used lots of different modalities. We reached out individually over phone calls. We also texted families. We used our email newsletter and worked diligently to get more emails and sign more families up to be able to receive that. And then we also broadened our reach across our Brighter Bites website and Facebook page. We created a family resource page on our website. We created city-specific social media platforms to be able to give more targeted information per city, and have just had a lot of traction there, gaining followers and engagement from families and from people in need and helping them connect the dots. Next slide. So these are just kind of some images of what some of the resources look like. We developed lots of flyers like what you see here on the left. This was specific to the Dallas team and links and resources for families in the Dallas region. We made one of these for each of our regions. On the top right, you see a graphic that was included at the top of every family newsletter that included COVID-19 resources in each of the regions, as well as national resources. You can see there that we're pointing families to the emergency EBT programs to be able to get the funds for the PEBT in many of our cities. That our families are the target audience for that, and so we really were trying to make sure they knew about how to get that information. And then we also did our best to reach out to other partner organizations and other folks who are doing just great work. We loved Coach Joe that we found. He put out weekly and sometimes daily activities for parents to do with their kids, and so we featured those regularly in our newsletters, and also featured other content from other great health promotion providers. Next slide. The latest thing that we're working on that is not ready yet, but we're excited for it, is a development of our mobile app. There finally will be an app for that, for Brighter Bites. It's in development to help leverage our library of 200 plus recipes, tip sheets, produce how-tos, make them available easy in a mobile format to anyone who can access the Apple and Android app stores. These are all currently available for free on our website, but sometimes it's a little clunky using it on your mobile phone. And so we're excited to have a much more seamless experience in store, not only for Brighter Bites families, but for anyone who has interest in looking at our health education materials. And then we're also going to be using this app to help in the new school year with delivering these produce boxes to schools, to reduce the person-to-person contact between our staff and families that are picking up. We'll be using QR codes, and the app will integrate to be able to let families check themselves in instead of having to interact with a staff member to check in. So we're hoping to launch that this coming fall. Next slide. And Speaking of fall, I know that the whole country is worried about how to open schools, pressed with the urgency of opening schools because there's so many families who need to return to work and kids need to keep learning and they benefit so much more from in-person instruction. We at Brighter Bites are trying to do our best to set up a program where we can continue to serve schools nutrition access, give them access to healthy fruits and vegetables, even if the school has to shut down. We're trying to work with the school to have something scheduled on campus that day of the week that families could come pick up produce, even if for some reason school was all remote that day. We're projected to continue to use the boxes that I mentioned through the USDA through the end of this calendar year. That's the projection for that program's length. And after that, we don't anticipate this to be a normal year when we bring parent volunteers together in a closed indoor space and have them breathe heavily and lift produce bags and create sets of produce for each family. We don't think that that's going to be safe or realistic, or the principals are going to want us bringing parents onto their campuses this school year. So we're making plans to treat this school year differently, and even after this USDA Brox program is over, have somehow pre-sorted bags or boxes delivered to schools on their assigned Brighter Bites days. And we're looking at integrating these new strategies long-term. We're learning how some of these different strategies are really a better fit for some school communities, whereas the old model that Brighter Bites started with works great for some communities, is not as great for other communities. So this is really forcing us to think outside the box and make sure that we're reaching the families who are in most need in each of our cities. Next slide. So we'll also continue to emphasize the importance of nutrition education. The Catch Global Foundation, along with Flag House, pivoted quickly when COVID hit, and they adapted the Catch curriculum to the Google Classroom environment. And our teachers, we promoted that with them. They really enjoyed that. I know Catch has got more exciting things up their sleeve to help teachers teach remotely and even help parents in the upcoming school year. So we're continuing to stay in close contact with them, and we'll leverage their innovations as well to help our teachers. As I mentioned, we have increased social media presence in each city. And as we expect there to be a continued increased food insecurity amongst our families and the populations we serve, we're expecting to have higher enrollment in this next year. We're expecting to have to send more food per school. And we're just making plans for that and fundraising accordingly. Next slide. So these are a glimpse at our program partners, and I thought I would land here to kind of scroll back and look through some of the questions that have been asked. And Shreela, if you'd like to join me with answering these questions. First one thank you. The first one I saw is, what is the source of the produce? And this slide is a good one to kind of talk about that. We work, if you look at the middle row, Houston Food Bank, North Texas Food Bank, City Harvest, Capital Area Food Bank, Harry Chapin Food Bank. That's 5 food banks we work with in 5 of our 6 cities to help get as much donated produce as possible. And then we also partner with other food producers to donate additional food. So that's a lot of these other logos you see on here: Brothers Produce, Diorigo, New York, Hardee's, Coastal Companies, Lippman and Taylor. Those have all been key donors that have helped supply this produce. Another question we had is Brighter Bites being implemented in El Paso? And I also saw questions about San Antonio and questions about expansion. We're interested and have been from the beginning in making this be a replicable model and having this be something that's implemented and can be implemented almost anywhere. So we're absolutely interested in having conversations with stakeholders in these cities and seeing if it's feasible to bring this model there.
Can I just add to that, Mike? You know, Brighter Bites has been most successful when there has been an existing champion in the city to pull the program in. As Mike mentioned, the food banks have been tremendous in supporting program implementation, and many of the cities have been the champions. to bring it the program in, as well as the produce company. So I think folks who are interested should definitely reach out and contact Mike.
Yes, we have a whole team of people. We'd love to have some of those initial conversations and kind of help you think about how, even if it's not a ripe time to bring the full program, how you could maybe take some of these learnings we've had to help your communities as much as possible. We had a question about the vouchers. How were we able to make sure that they were used on produce? And that was on the back end in the computer systems accepting these like HEB is able to determine from the UPC what department it came from, and so they only allowed purchases that were from the produce department. Interestingly, at HEB, that meant you could buy tofu with our voucher because they have tofu in the, but you couldn't buy frozen corn because that's not in the frozen fresh produce department. So there's some interesting nuances in working with them, but it was really gratifying to be able to supply that much. And we saw what families were buying, and it was, the vast majority was staples such as potatoes, onions, apples, carrots, as well as specialty items like cherries and mangoes that normally they may not have been able to afford. We had a question about across the nation, how many families participate in Brighter Bites programs? And second related question about how many individuals, not families. Do you want to take that, Shreela? Or
sure. Yeah, I mean, it's about close to 24,000 families that participate in the program each year across the 6 cities. Houston is the biggest footprint. And then there's, of course, the other cities as well in Texas and outside. Was there related? How many individuals? So our average family is 3 kids and 2 parents. It's a family of 5. So it would be 25,000 times 5. So about 125,000 individuals that would participate each year in the program.
There's another question about communication. What has been the best mode of communication for us to communicate with the most families? I think we could say hands down it was text messages. Even in some of our phone calls when we were trying to reach out to these families who had expressed concern and we wanted to see if we could help them, they were much less likely to answer the phone of an unknown number, but much more likely to respond to a text where we have a friendly person introducing themselves as being part of Brighter Bites.
And it's the same with surveys and the evaluation as well. Text seems to be the best way. Nobody picks up the phone anymore. And email is certainly a challenge. So texting seems to be the best way, even from an evaluation perspective.
One interesting note on that, though, that we've learned, a lot of our target demographic families are on these month-to-month plans that don't necessarily have a unlimited number of texts. And we use text to let them know about some of these emergency food distributions. And we began to see a pattern that toward the end of the month, we saw less participation in our food distributions. And this is just a hypothesis, but we really seem to line up with it. When families ran out of text messages, they weren't getting the notification about a new food distribution, and so weren't able to show up and participate. So even though it worked well, it was not a perfect solution for all of our families. Is there a toolkit available? We actually do have a toolkit that's on this. It's as part of the SNAP-Ed toolkit. We've been received SNAP-Ed funding in both Texas and New York, and we can share a link with that. I'll look that up and make sure we share that out. How much of the produce BB distributes is grown in the US or local to the region where it's distributed? We have people on our team that can answer that question a lot better than me and Shreela, but we'll do our best. We try to get as much donated as possible, and in what we've learned about the United States is that a lot of these growing regions supply food banks that are near them. And so here in Texas, there's a lot of produce that comes up through the Texas-Mexico Valley. And so that produce is more local to us, and we are able to use a lot of that. But then there's other items that are not grown in Texas that have to be imported. And when we're talking about the scale of produce that we're delivering to families, for instance, here in Houston, we're at more than 45 sites with over 200 families per site. We can't realistically give everyone a cucumber from a local farm that only grows so many cucumbers. Like we have to deal with larger scale farmers, and so there is some importing from other sides of the country to get some of this product.
And just to add to that, I'll say that that's where on this slide in front of you, you'll see Cisco as one of the program partners. That's where many of these partnerships with food distributors and growers come into play that already have a distribution system in place that we can leverage on to help bring the produce into the cities where we're programming. So that's been a tremendous game changer for Brighter Bites and making sure we are sourcing as much as we possibly can.
There's lots of questions here that I want to make sure to get to. So
let's answer the question about the majority of your clients on WIC or SNAP. So about a third of what's interesting is the eligibility, and this might answer a couple of questions on there, but the eligibility of the program is at the school level. So if the school qualifies, if you go on the Brighter Bites website, which is www.brighterbites.org, there's a membership application for schools, and the schools will complete that application, and then Mike will deploy his team to screen them and visit the schools and so on and so forth to make sure that the school is eligible in terms of the 75% of the families are on the free and reduced lunch program. But beyond that, there is no individual level screening. Everybody in that school is eligible to participate in the program, and that's an important criteria from making sure that we're not stigmatizing anybody. Everybody needs to eat healthier regardless of income. I mean, right. So that's one point. And the second point is the stigmatization. We want to make sure that all kids feel that they can participate in the program and be excited about it. But when we do collect data, we ask them about government assistance, if they're participating, and about a third of our families are participating in SNAP and WIC. We don't ask, well, very few, less than that are in WIC because it only goes to age 5. So if they have a child who's not under 5, they may not participate. But we don't drill, we haven't sort of gone deeper into why they're not participating in SNAP. If they do ask for SNAP enrollment assistance, many of the food banks do provide that assistance, and we can connect our families to that as well.
Yeah, often we see that if they're not enrolled in SNAP, they're still eligible for SNAP. They just need some help figuring it out. So I think, yeah, you answered the next question about financial requirements. There are not. There's a question about if we have other nonprofit partners, not including food banks, helping to champion the program. And I'd say yes, absolutely, and that's only grown since COVID. We've found new partnerships or new ways to partner with new types of organizations to either deliver these USDA food boxes, to collaborate on getting other resources to families, whether it be rental assistance or educational materials. In New York, we had a really interesting connection with a few different nonprofit agencies to help put some furloughed restaurant industry workers back to work to help pack boxes for us to actually deliver directly to Brighter Bites families. And that couldn't have been done without some innovative partnerships with nonprofits local to those regions. So yeah, we've had a lot of fun success. And if you represent a nonprofit that's interested in working working with us. We'd love to have a conversation with you. There's a question about the Head Start program using the Brighter Bites curriculum. As I said, I'll share the toolkit that we have, but the curriculum that we use for Head Starts is available independent of Brighter Bites, and its actual author is with us today. Her name's Shreela Sharma, and so she could talk a bit maybe about the Catch Early Childhood curriculum and how that is something that is available as well as Catch It Alone for schools.
Sure, yeah, so really quickly, I know we're getting to time, but really quickly, the Catch program is, it's an evidence-based program in itself. It's a coordinated school health program. So if you look up Catch Global Foundation, Catch Global Foundation houses the whole repository of the Catch program that's available nationwide. For implementation. Brighter Bites partnered with Catch Global on this because we didn't want to reinvent the wheel. There's already a great evidence, Catch has been tried and tested through 16+ randomized controlled trial and has proven impact. So why reinvent the wheel? The early childhood, the Catch program repertoire goes all the way from early childhood all the way through middle school, and so you can implement any of the components as you see fit for your school or preschool. So the Catch Early Childhood program is the one that we've implemented extensively in Head Start and is available. And through Brighter Bites, there's no financial commitment from the school or the preschool. The entire program, including the food, is free to the participants and the families and the schools and preschools that participate in the program.
Yeah, and to answer another question that was there, no, we never say no to anyone. If your child is enrolled at this school, you're eligible to participate in the program regardless of your income. I think it would be good to advance to the last slide so that you can all see our contact information, because we may not get to all the questions, and we encourage you to reach out to us. We'd be happy to talk to you about any questions you have or elaborate on any of this.
Yeah, and even in terms of research, I know there's some questions on there. Yes, absolutely. In regards to outcomes, for example, we are partnering with UT Austin folks on doing work in that space. We're absolutely open to partnerships from both programming and research perspective. And we also have a lot of data available for analysis as well from our families. We have we try to get a response rate of at least 50% on the surveys at baseline, and then follow up the same families longitudinally for as long as they're with our program. And happy to talk more on any of those pieces. I think we're at time, so I know that we didn't get to all of the questions, but the webinar is available. It's recorded and will be available, and our emails are here. We are happy to answer any further questions. Feel free to reach out to us. Thank you very much.
Thank you all.